We'd like to call the meeting to order. And we'll begin with our land acknowledgement. In the spirit of truth and reconciliation, we acknowledge that we are meeting on Robinson-Huron Treaty territory. For thousands of years, it has been the traditional land of the Anishinaabe. Today, this meeting place is still home to many Indigenous people across Turtle Island, including the Métis people. We are grateful to have this opportunity to gather here. I welcome you and good afternoon, everyone. My name is Folgo Dalavadova, and I have the privilege of moderating this afternoon's meeting. I am a retired educator, principal of a high school, and also a member of District 3 Algoma RTOERO. I would like to welcome you here. Let us pause to recognize the privilege of being able to exercise our vote in a strong and free democratic society. This meeting today is intended to assist us in making more informed election choices. A few housekeeping points. If anyone needs to make use of the washroom, there are two of them. Right through that door, straight down, all the way down, is one set of washrooms. And if you go straight through the door, halfway down, and you turn to the right, as if you're going to the restaurant, there is a second washroom there as well. Cell phones will be respectful, so if you have a cell phone that is currently on, we'd ask that you either mute it or turn it off. And a reminder that respectful conduct is required on these premises throughout this meeting. There is also a table at the back there. When the event is over, you're welcome to look at some of the literature that has been put out by the candidates. The candidates of the four main political parties were invited to this event. Chris Scott is the Progressive Conservative Party of Ontario candidate. Correspondence from his campaign office indicated that he is unable to attend. Jaycob Jacques is the Green Party of Ontario candidate, and he also has sent his regrets. Now I would like to introduce the candidates who are present in the order in which they will start answering questions. This order was determined just a few minutes ago by drawing lots. Candidate A is Gurwinder Dusanjh, representing the Liberal Party. Would you raise your hand? Thank you. Vezeau-Allen is the candidate representing the NDP. And last but not least is Arnold Heino, who is the candidate for the U-Blue Party. Thank you. I will explain the agenda and the ground rules for this afternoon. We will start with approximately an hour of predetermined questions on topics of particular interest to seniors. These questions will be posed by a panel of representatives from the Algoma branch of the National Association of Federal Retirees. Linda, would you raise your hand? There you go. And representation from District 3 Algoma RTOERO, Wayne Greco. Thank you, Wayne. I would ask that the panel members to identify themselves as part of their association, which was just done. This will also let us know that the sound system is working properly, and we did test it, so I think we're good to go with that. Starting with the Liberal candidate and alternating, each candidate will be asked the same question and allowed 2 minutes to answer the question. The next round of questions will start with the second candidate, and we will rotate through 1, 2, 3, 2, 3, 1, etc. I'll keep track of that until the hour is over. A timekeeper will keep track of the time allotment to each candidate for each question. There will be a signal to let candidates know when their time is up. And there is the signal with the red card. It's like the red flag for the bull. When a candidate sees that there's a signal, he or she is required to wrap up by bringing their current sentence to a close. Once the panel has completed its questions, the audience will be invited to ask their own questions. An audience member can address their question to one or more of the candidates. And the audience questions will be approximately 15 minutes. We'll make a little judgment on that. At that point, I have a wireless mic, so you don't have to get up and come forward to a stand. I will come to you, and then you can ask your questions from where you are. When the audience question period has concluded, each candidate will be invited to make closing remarks for 2 minutes each. Again, the time will be monitored. The formal part of the meeting should end somewhere around 3:30. The order of closing remarks will be in reverse seating order. So, let's get underway. May I ask the panel to pose its first question? And the first question will go to the Liberal candidate. Flip.
Okay. Yes. The first question. Ontario ranks last among all Canadian provinces in public hospital funding per person, and we have the fewest hospital beds per person compared to all other provinces. There are long wait lists for hospital services, patients left waiting on stretchers and hallways for beds, delayed treatments, and dangerously high hospital occupancy rates. Ontario has the fewest nurses per patient of any province. Private for-profit staffing agencies are charging exorbitant rates to hospitals and driving up public health care costs. Sault Area Hospital, like most hospitals across Ontario, has been operating without stabilized funding. The funding it has received has not kept pace with inflation. There has been an unprecedented number of emergency room closures in hospitals across the province. What would your government do to address the crisis in Ontario's public hospitals, including the nurse staffing crisis?
Hello, thank you very much for the question, and thank you very much for having me here. It's actually my first rodeo, so it's pretty exciting. To that question, is everyone able to hear me from the back as well? Yeah. Perfect. For that question, I actually do agree. I had my sister go to the hospital. She was there for 7 hours, and there's something wrong with that because those 7 hours for some people is not just a period of time to wait. It's something that can mean a difference between something that's successful and something that's complicated, right? After going through all the platforms, I found that the most reasonable approach to it was the Liberals platform. They had a plan to hire over 3,000 doctors throughout Ontario. But then what I've noticed as well, especially with what's happened in the Soo with over 10,000 people losing their doctor, is that as doctors come to the age of retirement and leaving the profession, there's no plan implemented to have those wisdoms passed on to the next generation. And that type of wisdom would take years, if not decades, to build back up. So they do have a plan to increase the residency spots, recognize internationally trained doctors, and that could mean our kids that have left from here and studied abroad and then are coming back but are able to practice, and also to implement new technologies to, instead of using faxes, which take time and just bogs down the system, we could use AI and other messaging platforms to have those documents transferred. And one thing I've learned from a lot of stakeholders is that doctors they're actually trained in the medical field, however, they're actually bogged down by paperwork right after that. So they're not applying the skills that they have, which is a disservice to them and a disservice to us as a community. So their plan also is to have supportive staff in place that would deal with that paperwork on the evenings and weekends so doctors can do what they were trained to do, and that's to tend to their patients without having to deal with all that paperwork. I think those plans would be a good plan to have in terms of decades long, because everything else I see is either throwing money at the situation or just having it neglected, and we can't be doing that no longer. Thank you very much.
Thank you. The next answer is from the NDP candidate.
Thank you. I'm first going to address the nursing shortage. The NDP has a specific northern platform, and in that platform, we are going to hire more nurses and establish and legislate safe nurse-to-patient ratios. I also know from my time, I'm also part of the District Social Services Admin Board, which takes EMSs under that. And we have a lot of wait times that also ties up ambulances and paramedics. So we need more doctors, to be able to be in the ER, and we do have a northern plan to recruit 350 physicians specifically to the north, 200 being primary care. That does not, however, address the hospital budgetary issues, and I know that Sault Area Hospital is running on a deficit. So as your MPP, I will work with the hospital board of directors and take a look at the funding model and where the gaps are and where we can have improvements. Thank you.
Thank you. And finally, from the New Blue candidate.
Well, the New Blue stance on that is, first off, bring back all the nurses and healthcare workers and doctors that lost their jobs to the mandates before we bring anybody else in. Another thing is we've got to quit with the red tape and all the top-end heavy, top-end bureaucracy of the healthcare system. We have too many top-end and not enough lower-end. Another thing too is we have to keep the WHO, World Health Organization, out of OHIP. And that way, because they've been penalizing the doctors for free speech. When the doctors come out and they will have an idea to make things better, the OHIP or the Doctor Association shuts them down. Plus doctors have way too much paperwork, and we have to stop that. Let them do what they're paid to do and what they're great at. Thank you.
Thanks very much. And we are now into our second question. The first answer will come from the NDP candidate.
Thanks, Vogel. 2.5 million Ontarians are without access to primary health care. The number is growing. Here in Sault Ste. Marie, 10,000 residents found themselves without a primary care provider when the group health center was forced to de-roster patients because of shortage in family doctors and nurse practitioners. Primary health care is important because it is the gateway to all health care. We have not seen a significant increase in the number of primary care providers, nor has there been a significant increase in the number of publicly funded nurse practitioner-led clinics. Instead, across Ontario, there's been a huge increase in publicly funded for-profit healthcare and a growing number of people resorting to dubious online medical advice. What would your government do to improve access to primary care and stop the privatization of healthcare?
Thank you, Wayne. As I stated previously, in the Northern Platform is the plan to recruit 350 doctors, 200 primary care. We're going to invest $4 billion over 4 years to make this happen, and this is going to happen in the first 100 days of government. Regarding the de-rostering of the 10,000 patients at the group health center, which was built by steelworkers in 1962, our government, our leader, Mark Stiles, met here with 25 union leaders, healthcare providers in March of 2024 when the de-rostering happened. Our leader, Mark Stiles, met with Mike DePratt and others at Queen's Park. We were there. We have been there all along. The other really critical piece of the Northern Platform is to have a regionalized command center for the North that will handle referrals and make paperwork less in terms of making it more automated. I met with the Ontario Medical Association President, Dr. Nowak, last Monday. He loved this idea, especially with having the specific Northern Platform for referrals. Will be definitely a game changer in connecting folks with primary care. Thank you.
So one of the reasons for backlogs in our healthcare system is we have too many people coming into our city, into our country, into our province. We don't have the staff, we don't have the resources to take all these people in. We have to worry about Sault Ste. Marie first. And we should actually, along with the public healthcare system, give people a choice with private healthcare too. I'm not saying privatize healthcare, but give them the option to have public and private healthcare. You look at in the Netherlands, it's number 2 healthcare system in the world, and they do a very good job of running it.
Thank you. One more person has to answer.
So to address that situation, I actually talked to a lot of people who are a part of that de-roster organization, and it's very difficult to find new doctors, especially if there's no one that's able to fill those gaps. So I believe in the Liberal platform, they have spaces that are going to be reserved in residency for students who have studied medicine and need that residency in Ontario. There's also a plan to incentivize healthcare practitioners, nurses, and doctors who are practicing currently in the U.S. to come into Canada and practice here with a signing bonus of $150,000. That one would incentivize, especially with being a border city. I know some doctors, I know some nurses more so, they actually practice their field across the border just because the opportunities are there. If we could attract that talent back to here, I think that will go a long way in addressing the shortfalls we have. Plus, with the recognizing of the internationally trained doctors having the residencies here, and then having the incentivization to stay in Canada after those residencies are done, I think that would be a good long-term plan to address these issues. Nothing can happen overnight, but if we don't start thinking about tomorrow and the year after, then we're going to have to deal with the consequences of that. And that's what we're seeing right now after 7 years of inaction. And again, just throwing $1.6 billion at something which is less than the cost of a swab will not be fixing anything. So I hope that we can look for long-term solutions that can address these issues that concern us now.
Thank you. That concludes our second question. And we're into our third question.
This next question deals with aging in place. The majority of older Canadians want to age in place, which means having the health and social supports and services that are needed to live safely and independently in our own homes and communities for as long as we wish and are able to. Key components of this are the availability of affordable, supportive housing developments for those older adults who may need to give up the home they live in now, but have no desire to give up their independence, along with consistent home care services provided by trusted home care workers. What is your party's plan to address aging in place?
And the first answer is from the New Blue.
So, I worked at the hospital in West Parry Sound, Health Center in Parry Sound. I was on the board there. We gave a program to get elderly people out of the hospitals, so that way they could get home rather than stay in the hospital. So we had hooked up with the Victorian nurses, and we would have sent somebody to go to the house and do the blood work. A lot of times it was just INR. But it was a great program that throughout the whole Parry Sound district. It went fantastic. We got people out of the hospital. We got elderly people back in their homes. And plus they didn't have to come into the hospital to get the blood work redone. We just did the service at home. It was there for about 5 years until I left, I guess. I don't know if they still have it, but the program was very, very successful. And we had worked with the Ontario government at the time of doing that program, so that's what we should be doing as soon as having these services so elder patients can stay in their own homes, because they feel happier, they're more comfortable rather than a place where they don't know.
Thank you. And an answer from the Liberal candidate.
Well, perfect. So this one's going to have to address the needs of the senior community, because at the moment everyone has to go to these to the actual hospitals in order to have this attention and this care, which is actually bogging down the system. I believe that healthcare should be more, it should have an approach that deals with the situation at hand. So we should have segments of practitioners who are actually dedicated to in-home services, places where people are more comfortable and have more of a private manner to deal with them. That would have to incentivize those workers to be there as well. And that would have to come with a comprehensive plan. If we have everyone going to the same locations, everyone's going to be at a disservice. If we're able to find that a certain segment of population needs these type of healthcare coverages, such as if you're a young adult, instead of getting a full doctor, then if you have a physician that can keep you on the right bill of health, and then it would take away from the strain on the actual resources. And then if we're looking at in-home healthcare, if we're able to have the statistics in the data and then divert the funding to the right places, I believe that that will have a better outcome for everyone involved. So that's where we would go.
Thank you. And last answer from the NDP.
Aging in place is so important. My grandmother was 98, and we had her at home till she was 97, and then she went into the finished rest home. And in 2019, my father had terminal cancer. He lived in Wasaga Beach, so I had to go be with him. And what the NDP platform is establishing a caregiver benefit. I wouldn't necessarily say it was fortunate, but in 2019, we were during lockdown, it was a pandemic, so I was able to work remotely while caring for my father. If things had been different, I certainly would have not been able to do that to the same capacity. So caregiver benefit, we know that the longer that folks stay in their homes, they have a better quality of life, they have much better longevity, and that is something I think that is really, really important to our plan. Sault Ste. Marie has a higher than average aging population, about 48, sorry. I'm included, I get the senior discount at Shoppers Drug Mart. We're at about 48% over 55. So this is something that I think really touches it on the north. I had an aunt who I love dearly. She was 15 years at the Davy home. She had severe dementia. And if we had other things in place, I think she would have had a better quality of life. So just in terms of that, we also want to have more culturally appropriate long-term care facilities for both our Indigenous folks and Francophone. And we're going to work with the University of Sudbury and Nipissing University to make that happen in the north as well.
Thank you. That concludes question number 3, and we're on to question number 4.
Excuse me. Next question deals with pharmacare. Canada is the only country in the world with universal health care that lacks universal drug coverage. In 2021, Statistics Canada found that 1 in 5 adults in Canada, many of them seniors, did not have insurance to cover their medication costs. Last October, the Pharmacare Act received royal assent in the House of Commons. This framework for the creation of national universal pharmacare coverage requires that each province and territory sign a bilateral deal with the Federal Minister of Health. Ontario has not yet signed this deal. Would your government support a national single-payer universal pharmacare program and sign on to the federal pharmacare framework?
And the first answer comes from the Liberal candidate.
Thank you very much for the question. As far as I've seen in the platform, that is not on the list at the current moment. However, I do believe that that's something that we should advocate for. I have looked at all of the, essentially like the prices of these medicines, and they are going up and up. And if we do have a single payer system, I believe that the government can have a negotiated better price for these type of medicines and treatments that we all need. It's not only for one segment of the population, it's all of us are going to be benefiting from this. I do believe in collaboration between the provincial and the federal levels, and this is a bipartisan issue, whether you're on the blue team or the red team or the orange team or the purple team, whatever team you want to be in. Our pharmacare is something that we need to look into. Our federal government has taken the steps in order to have a plan in place. I believe that the province should also look into that and then do what's best for the citizens, whether you're in Canada or Ontario or in Sault Ste. Marie or Toronto. I think we need to have that in place in order to have a society that benefits and not just spending money for our individual medicines and treatments.
The NDP candidate.
Universal health care was born out of the NDP with Tommy Douglas many years ago, and I have some great young volunteers, and I was trying to explain to them this, and I said, well, you know Kiefer Sutherland? I said, that was his grandfather. So it is not in our platform, I'm going to be very honest. It is something I certainly would advocate for. I work with a lot of vulnerable populations. I work with folks that don't have health care. I know people that, struggle to even get like their diabetic supplies. United Way does do some supports with that, which is, I think, really important. And I'm proud to say at Grocer for Good, we have healthcare benefits for all of our full-time employees, which we recognized was something that was really important. So I will advocate for this. I will have, when we form government, that will be one thing that I will discuss with Marit Stiles, our leader, and I think it is really important because we don't all have extended healthcare benefits. And healthcare should not be a privilege, it's a basic human right.
Thank you. The new blue candidate.
So like the other two, we don't have anything on that, but what I can say is that I get kind of nervous when you have the government running a healthcare system. As you can tell, our healthcare system is not one of the best, far from being one of the best in the world. We have to look into where all the money is being spent. It's there's no accountability of where the dollars and cents are going to, and we have to do. They should be showing us exactly where everything's being spent. There's too much overhead cost, and that has to be dealt with, and there's too much top end. So, like I say, when you have the government running a system like that, as you can tell, the last 9 years, it hasn't done very good. So.
Thank you. This goes to the next question. Just following my notes.
Sorry. This next question deals with long-term care, which we've mentioned a couple of times in passing. In Ontario, there are more than 43,000 people on wait lists for long-term care. We need more long-term care beds. During the pandemic, the long-term care system failed the residents of long-term care homes. Death rates were especially high in privately owned institutions, yet the majority of new 30-year contracts and expansions are going to for-profit long-term care companies, some of whom are the same companies responsible for the horrific conditions exposed by the military during the pandemic. Would your government commit to making all long-term care homes not-for-profit and to building the needed capacity in non-profit homes? Secondary question, what would you do to improve conditions in long-term care homes?
Answer from the NDP candidate.
We have committed $830 million into infrastructure upgrades within the healthcare platform. I will advocate, and I certainly agree. I'm treasurer of Sault Ste. Marie Housing Corp. I have firsthand experience in working in nonprofit homes. I think that is the where it needs to go, and I would support that 150% and bring that up with our policies. And also in terms of care, we need to take a look at the Ministry of Health policies in long-term care and have a higher patient to nurse PSW ratio. I talk to public health workers, I talk to PSWs, I spent many hours at the Davie home while my aunt was there for 15 years and saw the struggles that they have because they care. They want to provide better care. So we definitely need to take a look at the whole system because we do have an aging population and we need to improve access to folks, reduce the wait lists, and have better policies in terms of ratios for caregivers. Thank you.
Thank you. The new blue candidate.
So we definitely have to hold these private institutions accountable and make sure and have more accountability from them and see more of the books, because there are a lot of private old folks homes that they just skip by, and it's something that definitely has to be looked at. Another thing, with long-term care, the New Party will stop the MAID program. There's a lot of people that have contacted me about the MAID program and saying that they've been offered this, and that should absolutely not be happening in our long-term facilities.
Thank you. Liberal candidate.
It seems like every time you blink, something else is privatized. It's really concerning to see with the state of affairs. I don't believe that health should be privatized. Once you start putting profits above health, I've actually heard the term, without health, there's no wealth. And it seems like this government is putting wealth above, of individuals above the health of society. And I believe that is something we should look into. Because of the short campaign, it's not in our platform. I don't believe it's in any of the platforms, and I believe that was a strategic thing of this short campaign for it not to be in there and for the PCs to have an ongoing status quo. So I believe that privatization of long-term home care centers, as well as other privatization that has come about, should also be looked into. In terms of the standard of care, I've seen videos on CBC News, etc., of things that are inexplicable, lack respect, and should not be tolerated, especially in a country such as ours, in Ontario and Sault Ste. Marie, where else. So we definitely have to look at these standards and have a reevaluation, and those feedback need to come from the people who are being affected, not just by people who are doing these surveys or have their offices. It has to be by people who are being affected on the ground level. So it's something that I would certainly advocate for. And it's something that, regardless of what party gets in or what candidate gets in, I hope that there's a change when it comes to that. Thank you.
Thank you. Question number 6.
Thanks. Our members are very interested in environmental stewardship and the effects of climate change. The responsible use of resources, conservation, protection of our air, land, and our water are all critical to a sustainable future. The environment can't be an afterthought in our decisions. It needs to be part of all decisions, a reference point. Describe your party's long-term energy plan for Ontario. What would your government do to promote the reduction of greenhouse gas emissions? What role would renewable energy play?
Answer from the Liberal candidate.
I've also lost count, sorry.
We're back to number 1.
Fair enough. Okay. Yes, as I said before, without health, there's no wealth, and without a place to stand, there's no health at all. So we actually do have to make these tough decisions. I do believe, especially in Northern Ontario, with the mines and with our precious minerals, I believe it's something that we should invest into. It looks like renewable energy and the technology that follows that is on the uprise, and we need to invest now in order to secure those jobs in the advancement in that industry here in Ontario before other areas of either Canada or the world start capitalizing on those. Other areas that don't have as much stewardship as we do. Our mines are more cleaner than other mines. Our industries are more cleaner than other industries or other industries in other places. So we need to invest here in those clean energies. For example, a lot of our energy that we currently get and we sell to America is from the wind that is just north of here, and also from the solar that we have just west of here. East, west, I reached right of wheat. Yes, east of here. So it's something that we need to continue investing in. I'm hoping that we prioritize Northern Ontario with that, because we do have the resources up here in order to capitalize on those. And once again, if we start making decisions and have the environment as an afterthought, we're going to come into situations like the Greenbelt, which is still going through investigations, and that's a particular piece that we need to keep for our future generations. Because once we start disrupting the environment's going to answer back, and we're going to be seeing that in ways that we've seen on TV, and we don't want that here, right? So that's what I would say to that. Unfortunately, because of this condensed campaign cycle, it doesn't look like the Ontario Liberals have that in their platform at the moment. But once again, it's something that we should advocate for, and I believe historically we have been a party that has been responsible in that manner. Thank you.
Thank you. Response from the NDP.
In our Northern platform, we do have an infrastructure plan for municipalities. So Northern municipalities rely on, what do we see outside? Snow removal, busing. So we are going to provide funding so that they can make the purchases, such as what we've been seeing with the city lately with having electric buses. So we want to look at alternative ways that we can support municipalities through the provincial funding, model to make municipalities less resilient on carbon fuels. The Ontario Provincial Climate Change Impact Assessment that was published in 2023 stated that Northern Ontario is at high to very high risk because of climate change. And I think also you just take a look at in terms of transportation, we don't really have clean transportation. So I definitely would support more clean rail so that we can get from place to place rather than having everyone always on our highways. Thank you.
Thank you. And a response from the New Blue.
In the New Blue Party, we will eliminate the government green-funded green and climate change policies. Regardless of what everybody's saying that oil is a fossil fuel, that's a bunch of bunk. Oil is actually a renewable source, just like the water. There's as much oil in the ground as there is water. We have the cleanest LNG in the world, in Canada. And all these electric vehicles that they're bringing on, you see Ford, GM, and all the big three automakers are stopping to make them because it's not going to work in Northern Ontario. And if you get just like a Tesla car that sits in the driveway with 0 miles on it, a 15-year-old diesel truck actually uses less carbon than it does to build a Tesla. I just forgot what I was going to say here now. Yeah. As for the climate change, I'm still waiting for Manhattan Island to be underwater, like Al Gore said in how many years ago? 20 years ago. He said Manhattan's going to be underwater, but meanwhile, all the rich people are building their mansions on water. So I'll leave it at that.
Thank you. And we're on to our 7th, and I believe the last question. Okay, question number 7.
As we've been discussing through the other questions, many seniors in Ontario are facing a number of challenges, including health issues, financial security, elder abuse, affordable and safe housing, and unfortunately mental health issues. So our question to the candidates is, what is your overall vision or strategy, a senior strategy, for improving the lives of seniors in Ontario and creating a just and fair society for all of us as we age? Because regardless of what you might think, when you're, and I'm adding this myself, this is an ad lib, when you're 20 or 30 or 40, you will be us one day, with any luck at all. So this is the kind of thing you really need to start thinking about. Thank you. Sorry for the ad lib.
Answer from the NDP candidate.
We certainly all face challenges with affordability. And the first thing that we're going to do in the first 100 days of forming government is initiate the grocery rebate. The maximum will be $120 per month. It will go directly into your bank account. It will be based on income and family size. We all need to eat. We are also going to advocate and have better policing around the large retailers and food prices. We want to have transparency, and as someone who's worked in food security, I can tell you that our wholesaling has increased over 30% since 2019. So it's real, but we also need to hold the large retailers accountable because they have record profits right now, and that's part of the NDP plan. We are also going to, in terms of senior care and mental health, a lot of seniors feel isolated. The pandemic certainly didn't help that. And we're going to increase funding to community mental health service providers so that there'll be more social workers available that can take care of folks in our community. And in terms of housing, our plan is to use provincial lands and donate those lands to nonprofit and co-op housing providers. I've been visiting all of the housing co-ops, and there is a large population percentage of seniors, and that would be, I think, a really great way of utilizing land that's not being used. And the co-op housing model works, and that's something that, as NDP government, we are going to initiate and promote. Thank you.
Thank you. And now the New Blue candidate.
Well, I think it's best with the seniors, it's always best if we can keep them in their own homes. They feel more comfortable there, they feel more safer. So I think we should do all we can to keep them in their own places. And then, for as long as they can, and then get more places that are safe, that they can be comfortable with. As for the food system, I gotta ask a question, where are you gonna get all this money from? Like, I mean, that's the taxpayers, the food stamp program, taxpayers gotta pay for it. It doesn't come out of, it comes out of our pockets. So we'll leave it at that.
Thank you. And now the new blue candidate.
Yes, wish me luck.
I'm sorry. Go ahead.
Liberal.
It's the Liberal candidate. My apologies.
No problem. Yeah, with any luck, I'll be sitting in one of those chairs one day instead of this one. But again, I guess the common theme is making decisions now that can foresee into the future and having those systems in place for when we need them as well, right? So, for example, in terms of like the cost of living, I believe in the platform there's the official stance on the carbon tax, which has been contributing to a lot of the cost of living, at least from the stakeholders that I've been speaking to. There is an official position that we're against the consumer carbon tax. Hopefully that will provide some relief on the prices that we see, because of the prices that we see. Also, there will be a relief of business tax as well, and we're hoping, at least I'm hoping, that will translate into savings for consumers as well, as we can have those businesses, hopefully smaller businesses, reinvest into their companies and also provide those savings to the actual consumers. In terms of housing, I know that the Ontario Liberals wanted to remove the land transfer tax for first-time home buyers and for seniors as well, in case you want to downsize and not have those overhead burdens. And also they want to get rid of the development taxation as well. So hopefully with all of those, it will provide those reliefs. But I believe that seniors in general, in order to bring a higher sense or a higher status of living or condition of living, we have to advocate for the senior members, because when we advocate for senior members, we're actually technically advocating for ourselves in the future. So even though a lot of people saw me, they're like, why are you going to the senior event? I'm like, well, I'm going to be looking at myself in the mirror in 50 years from now and say I never did anything, right? So that's why I think that these would have to be conversations and advocacy. Again, with a shortened time frame, I did not see anything specifically for seniors in this platform, which I think is a disservice to both the party and to the actual people who are voting. So I find that advocacy is going to be the main thing.
Thank you very much. So, ladies and gentlemen, this concludes the candidate questioning period. And we're now going to open it up to the audience in case we want to give you an opportunity to ask a question of either one, two, or all three of the candidates with your question. If you can pose your question to whoever you wish. And as I mentioned earlier, I will come around with the mic. It's wireless. So we open it up now to the audience.
I'd like to know when you're going to bring these doctors here. You're saying you're going to bring 300 doctors. When will that happen with the NDP?
Within the first 100 days of forming government. That is the plan.
So the election is at the end of the month. So the next 100 days after that, you're going to get doctors here?
Would be once we form government, yes. That is in the first 100 days to establish the command center and start the recruitment, yes.
And you recruit them from where?
All over Ontario, all over the Canada, wherever we can. We also are looking at, we have almost 13,000 foreign trained doctors that are not able to practice in Canada. And we're also looking at how can we establish clear rules and work with the Ontario Medical Association and get them licensed. So that's also part of the plan. But that's not going to be in 100 days. But that is sort of, you got your short-term, mid-term, and long-term plan.
You also had the doctors come up, and then the people here, well, the government, would pay for them to come up here, take care of all of their expenses from going through school. If they
So there have been some learn and stay programs. I'm also seeing, especially out in Nova Scotia, there's a couple of municipalities that they're offering like $150,000 incentive to get doctors. But right now, in our plan, it's $4 million over 4 years to establish the doctors here in the north, and that is part of the plan. But it's within the first 100 days of forming government.
Okay, thank you very much.
You're welcome.
Thank you, Amos. Does anyone wish to respond as well? Go ahead.
Yeah, that's actually a very important question, because with politics, you just make promises, but there's no timeline associated, or when people make timelines, they say it's in 10 years from now. What I really liked about the Ontario Liberals plan was they actually put a timeline for 4 years, which I found to be reasonable. 4 years, and in the interim is to incentivize doctors who are about to retire to stay, to incentivize American doctors working in America to come over to the border with 150,000, and also to relook at Bill 125, which would give nurses and practitioners a living wage. That will keep people in this industry. A lot of people, the nurses I've talked to, they're like, yeah, we actually love what we're doing, we're actually getting a lot out of it, but it's not paying well enough, and all the stress is compiling. We have to give them a wage that will have them stay or attract new doctors. So in the short term, it will be incentivizing those who are practicing to stay. It will be incentivizing them to practice in Canada. And then in the longer term, it will be those residency spots and the recognition of internationally trained doctors to be practicing here. I know somebody who works at Sault Area Hospital in the nursing area, but he's actually a doctor from Mexico, and he's not able to practice here, but he sees, oh, I can do this, I can do that, but he doesn't have those steps to actually practice here now. So there's a short term, middle term, and long term, and I like how the long term solution of 3,100 doctors is only 4 years away, which is something we can work with.
The new blue candidate has an opportunity to respond.
So I got a question. Why did the government fire all the doctors that stood up against the COVID? Doctors are getting frustrated. They're afraid to speak their mind. We have very many specialists across Canada because they had a difference of opinion, but it didn't fit the government's narrative. So our government took their license away, and we have, I don't know how many in Canada and how many in Ontario that are still haven't lost their license. So first thing is we have to get rid of the government bureaucracy. The government is not the doctor. They rely on the WHO, World Health Organization. And you have, like, we have Dr. Makis in Alberta. We have a few doctors in Ontario that still haven't got their license because they had a difference of opinion. Last I heard of, like, if you get cancer, you always get 3 different opinions. Doctors want that because not all doctors are perfect. So it's time that we bring the doctors back, that the government let go first.
Thank you. Questions from the audience? We'll go 1, 2, 3.
Let the good-looking lady.
Again, on the doctor issue, you know, we live in a community where the standing joke is, if you're having a heart attack, go to Canadian Tire or Food Basics, you will see a doctor faster than at Emerge. Does any party have a plan to help these international doctors be certified here in Ontario? From what I understand, they have to write 10 exams. Each exam costs $5,000. They're going to school here, they're doing jobs they're not like super qualified for, they're trying to raise money. Why could we not do something like you pay $5,000 for your first exam? If you pass it, the government reimburses you. Then you've got $5,000 to write your next. So that out of pocket, they will only be $5,000 for 10 exams and be qualified here. Does any party consider that? Are you looking at it? Are you finding a way to fast track international doctors who live here in our communities? They're going to stay.
Do you want to direct your answer or your big answer to one?
Well, does anyone, party, have a stand? Yeah.
We do have in our platform to grow the workforce by getting licensing opportunities for internationally trained doctors and healthcare workers, so nurses as well. That's part of our platform. So we will have to work with all of the regulatory bodies to make that licensing more streamlined, more effective, and I love your suggestion about providing funding. We don't have a specific dollar amount for there, but it is directly in our NDP platform to do that.
Anyone else? Yeah, so as far as I'm aware, in the Ontario Liberal platform, they do have the idea or the intention to have the licensing be expedited or streamlined. And I do like your idea where the doctor doesn't have to pay out of pocket for all these different exams, especially when they're going to be providing a service. And at the end of the day, we're in a crisis right now. This is not just a small little issue, we can put it away, it's an elephant. It's a big crisis, so we have to be thinking about ideas that can get us out of the crisis. That $5,000 idea, whatever the amount would be, is very beneficial, because then once we see that there is an action towards wanting to take these exams, it's not like we're going to be penalizing them. Yeah, you just spend another 10, another 20 to get these exams, and that's going to delay their ability to practice. Whereas we need them now, we need them tomorrow, we actually need them yesterday. So it's something that we would advocate for. I believe with a longer campaign, I think these ideas should have been hashed out. I do think that the political strategy was, let's get the election going, and everyone else is waiting for these plans to come out. So it's something that we would advocate for, and I think that hopefully in the next election, all the parties come up with a platform that's costed and has real dollars to these figures. And I really like your idea, so I hope that whoever wins this takes that kind of idea and runs with it and tries to get some type of action from those ideas.
I think it's a good idea too. But talking to doctors and working in the healthcare field like I did, the biggest complaint that they have is the paperwork. They're so overloaded with paperwork, they spend half their shift doing paperwork. That's why you see a lot of doctors just working part-time now, because they're just overwhelmed with the paperwork, and that's their biggest complaint.
Thank you very much for being here. My name is Paul Morgan. It's a disgrace that the other two parties have nobody here. I personally feel that, and it should be said. It should be said. My questions are on health. Whether it's good fortune, bad fortune, I've been in the hospital here in Sault Ste. Marie, Sudbury, St. Mike's, and Toronto. There is absolutely no comparison on staff, procedures, efficiency, number of nurses, number of doctors between Sault Ste. Marie and the Toronto area. None. Coupled with that, it's not anybody's fault if they are referred to a hospital outside of Sault Ste. Marie. We get this pittance called Northern Travel Grant, which is a joke. My question to all of you is anybody looking at why is Southern Ontario so much better than us? Because we got 70,000 or 75,000 people here, and basically we get shit done. That's from doctors, nurses, staff, efficiencies, procedures, and we gotta go somewhere else. And if we have to go somewhere else, everybody looks the other way. Like, it's not my fault, okay? I'm asking all three of you, is anybody looking at that? Thank you very much.
So my question is, that's a very good question. And just for your first thing there, I wasn't invited to the first debates. I never got an email, and I never got a phone call either. I know I know we're not the FAB floor, as they call it, but still people of Sault Ste. Marie deserve to hear from all 6 candidates, and none of the candidates should be left out. I talked to a lot of people in Sault Ste. Marie are really irritated that the last 2 debates only had 1 person. So, as to your other thing, when's the last time we had a candidate up here worry about Sault Ste. Marie and not Southern Ontario? Everything goes down to Southern Ontario. You look, they want to build, the Ford government wants to build a new highway, whatever, but we got the worst highways and most dangerous highways in Ontario. They're not even looking at it. They can just look at this winter. How many accidents were there? The transport accidents. Just look at Sault Ste. Marie. We had 400 car accidents in Sault Ste. Marie. It's time we have somebody to represent us in Queen's Park that worries about Sault Ste. Marie and doesn't get bought up in the Southern Ontario BS.
Thank you for the question, Bob. And in our platform, we are going to expand and properly fund locum problems. So right now, my son needs to see a neurologist. The neurologist is in Sudbury. We do it via Zoom, but that's what we've got. Whereas if we have a better funded locum program, we can bring specialists here, which I think will be much more effective, and it's so much better when you can get care in your own community. The reality is that especially for some specialties, my father spent time at St. Mike's. I've been through that process. We're going to fund the travel grant. We're going to make it a more robust travel grant. It is certainly not enough, and I know that the United Way does assist with some folks, and it's a reimbursement program, and some people just don't have the ability to do that. I was stuck at Porter Airline at Billy Bishop, as many of us probably have been at some point in time, and there was a mom and daughter there that spent the night at the airport because our flight was canceled because they didn't have the means to get a hotel. And I wish I would have known. I knew when I got there the next day, I would have booked them a hotel. But there's a problem with our system that if you are stuck, there's nowhere for you to go. So we are going to increase that, but I think having a better expanded locum program will help us get the specialists up here rather than us having to travel. So I appreciate the question.
Thank you. Well, thank you very much for the question, especially with the passion there. I do apologize for not being at the previous meeting. I believe it was here, so I will apologize to you guys. I actually didn't get the email there, but I have reached out to them in order to actually have a meeting with them to recognize their concerns. That's essentially it. The last time after speaking to different residents here and stakeholders, the names I keep hearing are Rossetti and Tony Martin. People who did not, like one was on the orange team, the other one was on the red team, but they represented Sault Ste. Marie and its residents first and foremost. And those are the kind of politicians and leaders that we need, people who put their constituents over their party, over government itself. That's why I wear a Sault Ste. Marie pin. I'm not wearing a Liberal pin, I'm wearing a red turban, but that's besides the fact.
It looks good on you.
But essentially what we need is people who focus on Sault Ste. Marie and who are accountable to their constituents. So for example, an example, I actually drive on the Highway 17 every single day, and it's been pretty rough this year. But I'm on this Facebook group called Highway 17 and Let Me Kills because there's been so many accidents and lack of maintenance on that highway. And I've always asked questions why. And then when I learned that there was votes in the previous election and Ross Romano was there, he abstained from the votes. Now, to say yes or no, it might be because you want to toe the party line or this or that, but if your constituencies are going to be affected by a vote directly, you shouldn't abstain. And if you are going to abstain, you should open up your office, have a town hall, and then tell the constituencies these are the reasons why I did decisions. So I'm hoping whoever gets chosen has a monthly town hall where they invite the community, regardless of what political beliefs that the community believes, and is able to hold that politician or MPP representative accountable, or at least have the answers. Whenever I tried reaching out to the current representation, my emails didn't get read, or they got read and not replied to, and then whenever I knocked on the door, it seems like they don't even want you to knock on the door. I believe that in my office, I would have lives online with the question and answers each week, and then once a month have a debrief with the community, and then get that representation. Because what I feel like a lot of politicians or representatives think they're doing is representing the party to the people, but it should be representing the people to the party and to the government. That's how I believe that the way should work. And that's why when I look at the past representation of Sault Ste. Marie, Rossetti and Martin are ones that stick out, and that's who I hope can stand up in the future as well. Thank you. Oh, and also and then also in terms of going on the highways, we have to have some surgery. I've actually spoken to some people, and if you don't want to go on the highway because it's dangerous, there is a flight. Some people, because of health issues, can't go on the flight. And for some reason, we don't have any rail, which is bonkers to me because I went to Europe and I went from Italy to France to Switzerland, all on rail, and it's more of a leisurely travel. But I think that's because the North is not being advocated. So what I hope in the future is that the representation in the North, regardless of if some ridings choose NDP, some ridings choose Liberals, some ridings choose whoever else, I hope that they come together as a coalition to represent the North. Because as soon as we raise our concerns at Sault Ste. Marie, it gets drowned out. As soon as it goes as Timmins, it gets drowned out. But Sault Ste. Marie, Timmins, Thunder Bay, everyone gets together and says, no, this is what we need from the GTA. Because it seems like I'm working, I'm spending my tax dollars, and it's going towards the spa and a tunnel under the highway. That's what's going towards. And I'm hoping that whatever happens next, we get somebody who can advocate for the north.
I'm a strong advocate for public health care. I disagree about the going to have a partial plan where some people can afford to buy insurance to give them extra, because that's been shown in Britain and it's demonstrated in Holland that it doesn't work well because money tends to drift to that side because those people are paying big bucks. But I'm concerned right now about Life Labs. Life Labs is an American company. They took not in the $9 billion range back to the United States. All our records that we give to Life Labs are transferred to the United States. I'm now not certain that all my records aren't going to end up in somebody's pocket in the American government. I think that we should have a company that is Canadian or Ontario that is doing the work that Life Labs does. Their staff are paid less than what we pay the people working in the hospital for doing the very same job. So it's only making Americans wealthy. They provide great service, I admit that, but that is not the point. The point is we are supposed to be not a public healthcare system, and that's part of the healthcare system. And we are losing a lot of money to the United States, where it should be going back in to our government as a part of the maintenance, right? I have a second question, if I can just throw it in. This is, I don't expect a reply to, and this is time allotment. I have been doing a lot of study about bills being brought forward in the House and in the legislature, and a new thing has crept in the last dozen years, and that is time allotment, and it's getting shorter and shorter and shorter. That is taking away democracy because most of you representatives do not get to speak. I would like to see that go back to the way it was before time allotment was assigned. So the first question is, will the Liberals, if you form government, do anything to look at the money that's going to the states for the health care that's provided here?
So I think we're in an unprecedented time. Some of the most dropped as well as we've ever been on. However, with chaos comes opportunity as well. I believe with the de-investment or the change in consumer habits of shifting away from American products and services towards Canadian products and services, I believe gives us an opportunity to invest in what is currently being operated by foreign companies and putting in Canadian stakeholders and then having that control. When it goes to the privatization in the public aspect.
Excellent meeting. Good night, everybody.
When it actually comes to that, I believe that a lot of things have been privatized by this government, and I think we need to look at that. I actually do agree with you that we're supposed to be having a public system, and we can see where it's being privatized, and then we have to look at who those private partners are. So I'm hoping that in the next government, we incentivize Canadian companies, Canadian organizations, and Canadian workers to fill in those gaps that are currently being serviced by American counterparts and other counterparts as well. I think having Canadian stakeholders first have a better understanding of the matter, have an invested interest in resolving the matters, and also would keep the dollar in the Canadian economy as well, and the information too. In terms of time allotment, I just got my signs yesterday, which is, that's why you don't see my signs out. And I think that, just to speak candidly, I think that that was a strategy that was played, because you do see, I just found out about the election, and the next day I saw blue signs. And I know it takes longer than 1 day to get signs. It took me a week. I just got my Ontario Liberal email 2 days ago. So with this time allotment thing, I think that democracy or the way that we practice it has been so watered down. I would like to go back to the days of, if you remember McCain and Obama, where it was McCain and somebody was talking bad about Obama, and he stopped that lady and said, no, he's a good gentleman, we just differ on the way that this country should be run. I believe that we need to return to that as representatives. Civil debates, and this time it's failed. Thank you for the question there.
So the question about Life Labs, there's Life Labs, and then you have DynaLife out west, you have DynaCare in Ontario. They're private labs, but they are funded by the government. They have the same funding program as their public hospitals do. The only difference is that they're allowed to spend the money the way they want to. The hospitals have to spend the money the way the government wants to. I used to work in Life Labs, so I know how it works. But so again, I didn't know that Life Labs got sold to the American company. That's just news to me. I haven't been there for a while, but again, the funding is the same. It's just they get to spend the way they want it, and the hospitals have to spend the way the government wants it. So, and as for just to pick up on what he said, like it's amazing that the day they called the election, our city was littered with Chris Scott signs all across the city. Like, talk about election interference, I don't know.
In terms of the privatization and the Life Labs revenue not coming back into the community, that really needs to go into policy. It needs to be advocacy from the Ministry of Health, and we need to make it a requirement that our diagnostic services are not privatized, that they're publicly funded. So that's something in government we can do. Nothing's written in stone, and it's really about advocating and making sure that you bring the right policy changes in place. And I do agree that it should be Ontario-led for the people of Ontario. You know, we've been talking about tariffs and what's happening with our neighbors and a lot of uncertainty. So we need to really, in terms of economic development, that is an economic driver that can bring money right back into Ontario. So that is something that I definitely would investigate, and I would love to have a further conversation about that. In terms of the legislature, you know, I think in time allotments, that's definitely something when the NDP is in government. We're very fair, we're very democratic, and that's something that I definitely would bring forward as well in terms of that. My own experience was there weren't any billboards available in our community. They were all taken up. I don't think it serves anyone to say whether this was planned, meditated. We're where we are, we're in an election, run a good campaign, and be here for our community and for our voters. Thank you.
Any chance for one more?
Yes.
Military gave me that. I can talk. Go ahead. Can you hear me? I wish I could ask two questions, but I'll ask one. Everybody knows how bad Highway 17 is from here to Toronto. Everybody knows it's mostly two-lane. So you're in two-lane, out of two-lane, back into two-lane. There is a huge advantage. If I drive across to Sault, Michigan, and I've got I-75, and I can drive I-75 right to Sarnia, and I can cross the border, and I've got everything open to me for hospitalization. I cannot get covered. I've tried different places. I wonder, and here's my question, why can't OHIP offer an out-of-country plan that we would pay to the Ontario government, not to Blue Cross, not to all these dingy-dangy, we'll cover you for sure, but they don't. Why can't OHIP offer us that? Why can't they just say, listen, a yearly policy is $5,000 or $2,000. My last quote to go into the States was $8,000. I can't swing that. So my question is to OHIP, why can't you help us? Why can't you help us with, and I can't fly, so I have to drive. That's my issue. So I just wonder if I could ask all three of you, if you could investigate that, whether you could ask OHIP, or whether you could interface with the federal government and ask what is available. Thank you very much. Thank you, sir.
Bob, just to get some clarification, so you cannot access the healthcare services that you require here in Sault Ste. Marie, so you need to go to London?
I can get the health services, but they won't cover me. They'll cover my wife,
Not in the city.
but they will not cover me.
Goes to town, can't go to town.
Okay,
He wants to travel through the states to
It's
get,
faster to get
but he
around
doesn't have
the-
insurance to travel through the states.
so if you had a health issue in the US, you don't have coverage. You don't have out-of-country coverage.
You got it. And I have,
Okay.
by the
I
way,
was trying to get some clarification
I've
on.
explained it in detail to Blue Cross. I said, all I'm looking for is a 2 to 3 day health coverage in the States, so that if I'm driving to Southern Ontario, first of all, it's easier.
Yes.
Second of all, is that I can't fly. And I get back, yes, we'll cover your wife, but we won't cover you. So.
Is it because of pre-existing conditions?
Right on.
Okay.
You got it.
Okay. That's really important, especially in terms of geography, because it is quicker just because of
Oh, yeah.
geography.
Yeah.
Like, we can't control where the lakes and rivers are. For you to drive 75 to get to London, 100%.
And I've explained that
yeah.
specifically, that's all I want.
Okay, so that's good to know, and I think that's something that I would definitely be willing to bring forward, because it ties into access and being equitable.
Well,
So,
I'd appreciate it, I really do.
certainly
I think
100
for everybody in this room.
100%.
I really do.
Yeah, thank you for that.
Thank you.
Oh, actually, I guess the lawyer wants you.
I'm gonna do some interpretive dancing.
Yeah, following these answers, we will have time for one more question after this.
So definitely OHIP has to be looked into, and we have to have more access for healthcare for all Ontarians and all Canadians, but we'll worry about Ontario first, but definitely, it's an old dinosaur, and probably we have to get rid of a lot of bureaucracy in there. Unfortunately, it seems like the way the governments think that they can fix things is hire more people. So we have to get rid of the dinosaur. It's time to get into 2025. Definitely look at that.
Thank you very much.
So I suppose, I think it was 2013 or, no, it was after that. Whenever Ford got in place, I think he's the one who took out the out-of-province coverage under OHIP, which was unfortunate, because I figured, like, if there's a legitimate reason why you need that coverage, why is it not being covered, right? So I think a lot of the decisions that the Ford government has made in terms of our healthcare and the coverages that we have to be looked at. And then for your example, like if it's somebody that's young and is accessible to these private insurances, then that's okay. But for somebody who's not being covered and needs that medical attention, why isn't our government saying, okay, these type of situations, there should be it's not like you're doing a holiday, you're just trying to get to your treatment, right? So those kind of things have to be taken care of. But also, it's a disservice to us as Ontarians, especially in the north, that Highway 17 is not being maintained to such a level that we're afraid to drive on it. I know previous governments have said that they're going to invest into it. I know that our representative here has abstained from those types, but that's something I would strongly advocate for, because one, it's a lifeline not only for our treatments in our families, but it's also an economic lifeline as well. And that's the only way to get in and out of the Soo if you don't take a plane, essentially. Other than that, then rail would also have to be advocated for. But I believe that the North is just being neglected and not respected, and that's just something that we have to advocate for. And once again, whoever gets in power, I hope that they talk to the counterparts across the entire North, and I hope a Northern Coalition goes to Queen's Park and says, these are our demands, and if we don't respect our constituencies, then you'll see what's going to happen in the next election.
Thanks very much.
Okay, one final question.
This isn't a question, this is just to reinforce what he is asking. I have an appointment in Hamilton in a week and a half. It takes me 10 hours of slow driving, so I can probably do it in 8. But it doesn't matter. I cannot go through the States. I can't afford the insurance. He said that he had $10,000, I think you said? 8,000. Mine's 12. I served in the Canadian Forces for 29 years. I have lots of injuries, and I cannot get anything cheaper than that. So it's necessary, if we were to go down to Hamilton and not spend 10 hours on the road, we could do it a lot faster through the States.
I agree with you 100%.
Thank you.
If I could just, we do have in the Northern Platform a highway safety plan. So $158 million was cut in funding by the current government for Highway 11 and 17. So our plan is widening Highway 11, Highway 17, and Highway 69, and building the Cochrane bypass further north to make it more accessible. But also when we're talking about transportation and access, we are going to have a northern rail and bus strategy. So I've met with the Bear Train folks, I've met with the CAPT folks. Our government is very aware that there's a lot of groundswell from grassroots organizations in bringing rail, and that I think could be a great solution for what we're doing in the north. And like my colleague here, I've been fortunate to travel throughout Europe, and I trained it all the way. Also, when I go to visit family, when I'm in Toronto for meetings, I take the train to Belleville. So, you know, I'm really happy to have that access when it's there, but we need to take a look at it. And the NDP government knows that it's necessary, and we're going to have a northern rail and bus strategy. Thank you.
Okay, thank you. This brings to an end the audience participation, and I have to, did I miss somebody? Sorry.
On Highway 17 and 11, all that, we have a lot of transports driving them highways now. And I'm watching W5, I think it was, and there's a lot of illegitimate truck driving schools down there that just give people license that have never driven here in the wintertime in their life. And as you can see how many transport accidents happened this winter, and it never used to be like that. The transport drivers, we're always great drivers, but we're getting illegitimate truck driving schools. They've been caught red-handed, and we have illegitimate driving schools at the same token, and they've been caught red-handed. So this has to be, and we got the Ford government, I don't know where his transportation minister is, but I think he might still be in Europe, I don't know. But we got to crack down on this, and so that we can make our highways safer for driving. But same token, we got to expand the 4 lanes. Like when I was in Parry Sound, working hospital there before they expanded the 4 lane from Barrie to Parry Sound, every weekend was a nightmare in a merge. It was brutal. They finally got that widened up. They now have to get farther up to all the way to Sudbury, and then we have to work on Sudbury to Sault Ste. Marie. And another thing too, we have to bring back the rail lines. I mean, I remember when I was a kid taking the old bud car from Sault Ste. Marie to Sudbury. So that was great. So we have to open them back up.
Thanks. I apologize, Arnold, for having missed you there. Oh, go ahead.
I would just like to say one more thing. I believe whoever the next Minister of Transportation is, I believe that they should drive the Ontario 17 as well. I know everyone laughs at that, but without having that experience, I don't think anyone's actually going to make the actual right necessary changes. So I believe whoever the next minister is, they need to drive this. It could be in a tour bus, whatever you want, but they need to see the conditions. Because as I'm driving on the north, I see these headlights coming at me. The snowbank's over here. How much space do I really have? Right? So that's what I think that the government needs to do. They need to put themselves on the ground level in order to make those decisions about
Only in the winter.
Yeah, exactly.
Thank you. Okay.
Can I say something to Heino?
Well,
The conservative candidate is driving Highway 17, and he will not be here till Sunday. That's why.
okay.
You must have a 2-cylinder.
Okay. I think my timing is better now. So this brings to a conclusion the audience participation, and I have to commend you for the significant, relevant, quality questions that have been asked of the panel, and likewise the opportunity to respond to those questions. It's much appreciated. Okay. So the next round is the final comments from each of the candidates. They have 2 minutes each. I will call them in the reversed order in which they began, which means the first 2 minutes of their final remarks go to the new blue candidate. You have 2 minutes.
Well, first off, I want to thank everybody for letting me be here today. It's my first debate, and it feels awesome, and you guys have been fantastic. One thing I want to say, I really firmly believe in is the first line in our Charter of Rights. Our country is based on the supremacy of God and the rule of law. We have to get back to If we're gonna get our country and our city and our province back on track, we have to get back to that. That's what our country is founded on. And going forward, right now, it's supposed to be we the people, but now it's we the government. The government is not to be overseeing us or telling us what to do and being a dictatorship. They work for us. They need to listen to us. And as your candidate in Queen's Park, it's up to me to listen to you and to bring your concerns down to Queen's Park. It's not up to me to tell you what to do. It's up to me to listen to what you want and bring it down and fight for Sault Ste. Marie and put Sault Ste. Marie first. Because I really think Sault Ste. Marie was a great city, can still be a great city, and it's time that Sault Ste. Marie can be a leader in Ontario, that everybody in Ontario could be jealous of. Thank you, and thank you for your time.
Thank you. The next speaker is the NDP candidate.
I'd like to thank RTO and the National Association of Federal Retirees for putting this on. I'd also like to thank our moderators and my two fellow candidates here for joining me today. I've been on City Council for 6.5 years. I've had to negotiate through multiple delegations, work within government, and I believe that I have the experience, the passion, the work ethic to bring what we need in our community to Queen's Park. Last year alone at Heino, the Association of Municipalities of Ontario, in 2 days, I sat through 13 delegations for our community, ranging from everything from saving the Y, to having more supportive bridge units, to mental health and addictions, to asking for more funding for our EMS. Our member of parliament was never present at any of these delegations. I was there on behalf of the city and my role at the District Social Services Admin Board. As your member of provincial parliament, I will be there with every delegation. I will be advocating for our community. I know what we need in this community, and we have a lot of wonderful things happening. There's a lot of great groundswelling. We have growing tourism sector. We have a vibrant arts community. We have all kinds of really amazing positive things. And we also have a lot of opportunity. When we're talking about the health crisis, we need to connect with our post-secondary institutions. Algoma University could have a pre-med program. Sault College could have a nurse practitioner program. We have to take a look at all of the assets that we have currently here when we're trying to address gaps in our community. And I want to thank everyone for being here today. I love our community, I love our city, and I'm going to be there with you at Queen's Park, advocating and working hard.
Thank you. And last but not least, the Liberal candidate.
Well, thank you very much for having me. It's not a debate, it's more of a discussion. I think that that's what people should go into these with. It's more of like, regardless of which party you support, I believe that the politicians are supposed to be working together, not against each other, in order to benefit society as a whole. As your MPP, I would like to be accessible. As I said, online lives, just to touch base with the community, would be a way to gauge what is in need for the actual constituency, and then actually having a town hall every month just to touch base again and be held accountable would be something I would like to see from our MPP, which I haven't seen in the last few years, unfortunately. And I believe that whoever we choose as our MPP should be representing us first and not their party and not their government. It should be the reverse. I feel like that's been lost in decades, and I believe that we need to return to that. And that's why I put my hat into politics, is because I was approached by the OLP in the last election, but I talked to my grandfather, and we were just starting this new business, Hayden Fuels, and he said, you know what, if you're going to get into politics, learn more about it, get involved at the community level, and that's what I did, and then focus on the family business. And that's what I've been doing for the last 2 years, since 2021 actually. And after doing that, and getting involved in community, I've seen that there needs to be a change that needs to be made. And that's why in this election, I did want somebody local to run. I did not like when a parachute candidate comes in. It seems like the parties don't care when they start doing that. And that's why I put my hat into the ring. And through listening to different stakeholders and community members, that's exactly what they want. They actually know that platforms and policies come from parties. Half of them might get done, the other half might not get done, or might get done halfway. But as long as they got a representative that represents them, that's what matters, and brings results for them, that's what matters. And like I said, I've been looking into the past of Sault Ste. Marie, or Rossetti and Tony Martin, great phenomenal names with great histories, and that's the type of representation we need in the future. So thank you very much, and it was a great discussion.
Thank you. This concludes our meeting, but I want to thank a few people before we actually open it up and end it, and give you an opportunity to chat with our candidates. The first person is Linda McDonald, who is representing the Algoma branch of the National Association of Federal Retirees, and Wayne Greco, who is the president, actually, and member of the District 3 Algoma RTOERO, and as well Barbara Perry, who's also part of the RTO Association for her red flag. And lastly, I want to address the three of you. It takes a great deal of time, effort, and courage to put yourself forward as a candidate. But your effort makes democracy a reality in our community. I would also like to thank each and every one of them for their participation today and for giving their time and energy and giving us a chance to follow the democratic process. You have the far end candidate for the new Blue Party, Arnold Heino. In the middle, you have a candidate for the NDP, Lisa Vezeau-Allen. And last but not least, the Liberal candidate, Gurwinder Dusanjh. Thank you, apologize. Let's give them a round of applause. The meeting is concluded. Please feel free to stand and stretch your legs, and if you would like to chat with any or all of the candidates, you're welcome to do so. Thank you for your participation.